Good morning, everyone. Thank you for joining. This is Andy Sherritt from IT Health. We'll be starting the webinar shortly, just allowing a couple more people to join. So please bear with us for a moment. Hello again, everyone. Thank you very much for joining. I think we'll make a start. There's a few people still connecting in, but they're only going to miss my little intro anyway, which isn't too important. So yeah, thank you very much for joining today and welcome. Today's webinar is all around Imprivata Identity Governance. In terms of housekeeping, the only thing to say really is that we would encourage your questions. So please use the GoToWebinar question panel to post those. I'll be monitoring them throughout the course of the webinar and we'll do our best to answer them towards the end of the session. So in terms of the people who are our sort of speakers today, first of all, most of you will know me. I'm Andy Sherritt, Head of Business Development from IT Health. Chaps, I'll let you introduce yourselves. Over to you, Andy.
Thanks very much, Andy. So I'm Andy Wilcox. I'm the Senior Product Marketing Manager for our international markets here at Imprivata.
Good morning, my name is Daniel Johnston. I'm a clinical workflow specialist and clinical safety officer with Imprivata, and I'm also a practicing nurse in the NHS as well.
Yeah, good morning. My name is Matthew Law. I'm a principal sales engineer at Imprivata, and I'm the product specialist for the identity governance solution.
Thank you, gentlemen. So I think looking at the people who've joined, most of you already know IT Health, but just in case anyone doesn't, IT Health are NHS IT security specialists. So we've got a portfolio of solutions and services, all geared towards the NHS and very much with a focus on cybersecurity, assurance, identity management. So I won't go through all of those in detail, but we've got a number of kind of vendors and partners that we work with. Many of those on the screen now will be familiar to you. We also kind of developed some of our own solutions for the NHS. So some of you will be aware of the assurance dashboard. We also have Secure-It, which is our two-factor authentication solution geared towards remote access. But today's session, as we've said, is focused on Imprivata. So I'm confident that it will be of interest. And at that point, I'm going to hand over to the team at Imprivata to take us through today's presentation. Over to you, Andy. I'm going to pass you the keyboard and mouse.
Give me control. Thanks, Andy. Let's just... Sorry about this. There we go. Okay, so for today's agenda, it's focused on our identity governance product, and we're going to go through, first of all, do a little bit of introduction to digital identity and our digital identity platform, and talk about how identity governance fits into that. Talk about some of the drivers for why identity governance is becoming increasingly important, particularly in the NHS. And then Matthew's going to do a demo of the product so you can see how it actually works. And then we're going to end by talking a little bit about our pilot experience with one of our NHS customers who's currently actively using this. And then finally, open the floor so you can ask us any questions you have around what you've seen today. So I really wanted to start by doing a little bit of scene setting. And 10 years ago, the world used to be a lot simpler in terms of digital identity and digital solutions within hospitals. And the majority of action that happened within the four walls of the hospital itself. It was really quite simple. You had clinicians who would access, on-prem application within the four walls of the hospital on the traditional thick client workstations. And it was, by today's standards, relatively easy to manage. But over the last 10 years, and particularly in the last 12 months, as we've seen with COVID and the adaptations we've had to make to new ways of working around that, that we've expanded vastly the number of users and roles who need to interact with the data, the healthcare data that we hold in our systems, from non-clinical staff through to bank staff and locums, and even through to patients now having access to their own clinical records. And we've also expanded the locations that we're giving access to this data from. So, telehealth has been very big news in the past 12 months, and remote consultations and users accessing the hospital data from their own home. We've pushed clinics out into the community. We've got more staff out on the roads doing community services and even delivering care directly in patients' homes where needed. And the consequence of shifting care outside of the four walls of the hospital is that we've needed to provision access to all of these data and applications on a much broader set of devices. So from inside the hospital perspective, thin and zero clients, connected medical devices such as vital signs monitors, and then as we go out onto the road, shared mobile devices, laptops and iPads and the such like. And then also, particularly in the last 12 months with staff having to work from home, increasingly the need to provide access on personal devices. And also the type of applications that people are using have expanded rapidly, and we're seeing much more SaaS and cloud-based applications being introduced, virtualized applications, and many more applications and data being made available through them on mobile apps and web apps as well. And what that is driving is this complexity with managing how we provision access to people, how we monitor that access, how we ensure that they have access to the right data at the right time in the right place. And that inevitably means ensuring that we have the right level of controls and security in place in front of all of those devices, all of those applications. But the knock-on consequence of that is inevitably frustration. The more barriers we put in front of staff, the more difficult it is to access something, to use something, to do the job that they come to work to do. And Dan's going to talk a little bit more about that in a second. So from an Imprivata perspective, we've been in healthcare for nearly 20 years now, and we've been hearing these stories, and they're only growing and growing and growing of this frustration and this expansion of the need to manage digital identity more effectively. And that kind of took us on a little bit of a journey to see what we could do to help support organizations in managing that more effectively. And we did some research. We looked at the likes of Forrester and Gartner, Microsoft, and all of these have identity and access management frameworks, particularly one from HISAC, which is a US-based healthcare orientated organization that define kind of major categories around digital identity that a framework could be built upon. So we took all of these different functions and categories that we'd seen from lots of other organizations, and we decided we were going to build our own based on our experience of the customers we worked with, the organizations such as IT Health that we work with, and the partners such as Microsoft we work with, and develop a framework that kind of encompassed all of these challenges and gave organizations a tool to help manage digital identity in a more unified manner. And then that led us to this, which is our digital identity framework for healthcare. And I'm not going to do a whole session on this because it's a lot to talk about, but I'll just give a very brief summary of the different sections. So on the left-hand side, we have elements that deal with governance and administration. So the standards you need to be compliant with, the auditing and reporting you need to provide on a regular or ad hoc basis. And then as we move across, we've got that identity management piece, which relates to how you deal with all of those identity stores that hold digital identity and how you manage the provisioning and deprovisioning of users as they join and leave your organizations. And then as we move across to authorization, it's how the management of access is dealt with and how you ensure that people have access to the right data at the right time in the right place, but conversely don't have access to data that they shouldn't have. And then as we finally move on to the right hand side, this is how that's operationalized at the front line. So how does a clinician, or can a clinician access all of that information and data efficiently and effectively? irrespective of the application they're using, irrespective of what device they're using to do that, and also have we got the right tools and processes in place to manage things like remote access, or where clinicians need to re-authenticate. And finally, do they have the right tools to manage to a degree some of their own actions like password resets? And that's what the framework encompasses. And it's a tool really for you as an organization to look at digital identity in a unified manner across your organization, to develop strategies to address areas that potentially need to be improved or looked at, and to use it as a tool to communicate internally and externally of your direction of travel. So as I move on to the next slide, this it shouldn't come as a surprise that we also map our products to this framework, and not going to go through all of our products today because our focus is about Imprivata Identity Governance. So if you look at the areas that identity governance touches, it's around that governance and administration piece. It's around the identity management, the joiner, mover, leaver challenges that we face, and also about that authorization, about ensuring that clinicians have the right level of access granted to them. And that's becoming increasingly important as healthcare evolves and develops. And we talked about, workforce and locums and bank staff. We have these days a very fluid workforce in healthcare. And we've also got, the evolution of how we deliver care, which is leading to new affiliations and mergers. So we've talked about STPs in the past, and we've now got the ICSs in discussion, sort of being implemented in certain areas. And compliance requirements continue to evolve and develop, GDPR, the local implementations of NIS, and just looking at what we're recording about patients, we've got a vast amount of data that's all sitting within these organizations that requires the right level of governance and to meet these compliance requirements. And all the while, we're also trying to protect from all that unauthorized access. And that's, from an IT perspective, that's presenting a massive challenge, and the need for security, strong measures to ensure that compliance is met, that data is protected. But the opposite side to that is the impact that has on the day-to-day operation of the hospital, of clinicians' lives. And I'm going to hand over to Dan now to talk a little bit about it from that perspective. So I think that's a really important point we need to talk about.
Thanks, Andy. I like to represent the end user, as it were, just to challenge my product management and engineering colleagues. So as a practicing nurse who's occupied kind of clinical, operational roles, both in terms of a team, a department, a service, I've had a large part of that role often engages and requires the management of credentials and access. So I feel like it's something that has been played a significant part of various roles. So I've kind of operated across various healthcare systems. The clinicians need to immediate access to systems and applications on kind of day one when they start, and how to accomplish that can be very challenging indeed, and is essential to delivering quality patient care. And clinicians understand the importance of having that access to data, but also keeping patient data secure, particularly in an ever-increasing digital world. These essential requirements are frequently in conflict and present clinicians with a dilemma, particularly with starting on day one and beyond. Today, the manual process credentialing is frankly a burden on all parties and involves a process that has implications across the organization. But from the healthcare worker clinician perspective, on day one, we're often challenged by access to systems. And it's a situation that's not known to be the case for maybe multiple days, or in some cases, perhaps weeks. The IT team administering and managing those credentials and the communications to ensure the appropriate credentials are being applied is also a challenge. And then there's the healthcare manager kind of series of correspondences, and more often than not, it's either initiated either verbally or through approving and email communication and then amending. So it can be a very laborious task. And then there's the information governance and security implications. Obviously have knock-on implications to managing incidents and accountability. And then there's obviously the transparency that everybody is striving for in terms of generating audit logs of what records have been looked at and by whom. So on the front line, the burden really translates into satisfaction and inconvenience at best. And it leads to, or that can lead to clinicians necessitating use undesirable workarounds to prioritize patient care. Meanwhile, operationally, there's excessive workload and complexity in these situations of managing credentials to the right person at the right time. And it can be administratively inefficient and it introduces a massive risk into organizations, as I've mentioned about governance and compliance. So really trying to find an identity access management approach is critical to ensuring the right balance of efficiency for patients, but also being compliant for security. I think just to elaborate just a little bit further, if you can go to the next slide, Andy. Thank you. I might ask Andy just to add a bit more colour at the end here, but just to elaborate a bit further on that kind of laborious process that is not as reliable as we would like it to be as a health service, as a team. And it can take, going back to the fact that it can take days a week for credentials to be applied, is not uncommon. Similarly, clinicians moving across organisations or occupying different roles is not uncommon either, and that really compounds the challenge that IT and various departments have. And it's all too often when nurses and doctors leave organisation, that access stays in place and exposes the organisation to non-compliance and it introduces a risk of compromising security and exposure of management of data can be greatly improved. So clinical informatics leaders are really looking to partner with IT and security counterparts, kind of tighten up that control, really, which would make a significant difference to clinical value. But taking these credentialing challenges on not only looks to mitigate and manage risk with onboarding and offboarding and the changing of roles of clinicians and healthcare staff, but it also helps tighten up that effective audit trail. Helps with health worker satisfaction and adoption of technology, hopefully with the intention of it being on day one, when they step onto a unit, a department, or interact with a patient on day one. And it benefits the clinicians to be able to kind of document from the get-go when they start to orient the systems and start providing patient care. And as you can see on the slide, I don't know if I can ask you, Andy, just to kind of take us through how that kind of tightens up management of identity access management as you kind of go along, speaking to the pain that I've mentioned.
Yeah, well, I mean, you took the pain, I think, is absolutely right. And I mean, a lot of the time, what you then find as a result of the pain that the clinicians face is workarounds to the barriers that are put in place. So you talk about, like, you know, if you weren't to have day one access as a clinician, then, you know, frequently could see something like generic accounts or account sharing being used, which is, you know, not good security practice from an IT perspective, and, you know, it may give that clinician access to systems and data that they shouldn't have. Yeah, and also you can see things like that happen, behaviours like copying accounts. So someone will join and they'll just copy an existing account set of permissions without checking, because they're the same doctor in the same department or the same nurse at the same banding or whatever, and you know that can lead to this challenge of inherited permissions. But coming back to what you were talking about, Dan, that clinical perspective, I mean, you and I have talked many times about the challenges and the frustration that clinicians face when something doesn't work or they can't access what they need to access to deliver patient care, and particularly when healthcare is under probably the greatest pressure it's ever been under. I mean, that's only going to be amplified by the challenges that IT can present if not made as seamless and efficient as possible.
Absolutely. Absolutely, and couldn't be emphasised more in an increasingly, where workforces are increasingly more mobile than ever before.
Yeah,
absolutely. When you're looking at surging of staff, given the experiences in the healthcare systems over the last year.
Yeah, and just to reflect on what we're seeing on the slide, I mean, this is what we're talking about with identity governance, but it's kind of the holy grail of a doctor joining an organisation, the HR feed or the HR system being used by the HR team to set them up as an employee in the organisation, and then automatically having all of the access granted to all of the systems they need based on the role that they have. So predefined, pre-canned set of permissions, then automatically provisioning their single sign-on so that they can walk up to a computer with their badge, immediately tap on, have access to all of the 2FA multi-factor authentication they need, and all of that to be logged as well. So when we come to the reporting, the auditing for governance perspective, that we know that Dr. Clark or whoever it is, what they've done, that they've been interacting with systems in the way that they're authorized to do so, and then when they leave the organization, that deprovisioning piece happens. So as Dan was talking about, not having those orphaned accounts in a system that's a departmental level system that isn't AD connected, for example. And that's hugely important from that governance perspective. So that's really what this is showing at a very high level. And I think what we're going to do now is pass to Matthew, who's going to actually talk you through how the solution works and give you a demo of that.
Yeah, thanks, Andy. Okay, so, oh, sorry, I've just been made the presenter, but there were still some slides to finish.
Sorry, Matt, my bad. I'll take it back.
Okay, no problem. I think it was time for the demo just yet.
Just to prove this is a live demo.
Yeah,
there we go. So yes,
Andy, you've got control again.
Yes,
thanks,
next slide, please. Thank you. So yes, I'm going to talk about some of the key elements of the Imprivata Identity Governance solution, and then I'll provide a live demonstration following those slides. So next slide, please. Okay, so the Imprivata Identity Governance solution is a complete end-to-end identity management and access solution. So we focus on healthcare as a company, Imprivata, and so all the products we design and build are focused on healthcare workflows. And we saw this kind of demand for, we've historically been known for single sign-on, but there's this demand now for how do we manage the identities of the users in the organization. So, and that's the entire life cycle from, kind of the onboarding through their journey, if you like, through their employment through to deprovisioning. So what we do with the identity governance solution, basically through the onboarding process, we can take automatic feeds or triggers, if you like, from different systems that hold identity data, such as ESR, the National HR System, or we could also take spreadsheets for things like locums, bank staff. We can take the deanery register so that we can do the student doctors, etc. So we can take those different feeds in, and there's also a manual process as well, but we can take those feeds in, and then based on their role, so this is a role-based access control system, based on their role defined in identity governance, we'll start to allocate them, different permissions, different rights, accounts, and access to different systems. And we automatically go away and create those accounts for those different systems in the background. So we're not only maybe creating Active Directory and email, we're also going on and actually creating accounts in all those different clinical systems that clinician needs access to. And that's from legacy systems like green screen terminal emulators, right through to modern day kind of SaaS and cloud-based applications. We can cover the entire plethora of applications out there. Now, when we create those accounts in those different applications through the automated provisioning, we also feed those account credentials, those usernames and passwords, directly into the back of single sign-on. So again, all to benefit the clinician. So day one, they turn up, they have access into the network, but they've also got automatically single sign-on to all their different systems. Now we understand that some systems you don't want to give users instant access to. There may be some kind of training that the user needs to attend, or there needs to be some kind of approval from somebody. So we can build those into the solution as well. So we can send out emails to training managers or line managers seeking approval. And once they approve or maybe upload a certificate that that training's been completed, then we will automatically continue that provisioning of that account into those applications. Now, that's great for the onboarding and kind of the creation process. But there is an ongoing management of the identity within the organization. And so I think Andy touched on this earlier. So when users move around, they need access rights maybe taken off them. They need access rights adding on, depending on what roles. They may be seconded to a different department, so they need a temporary role, you know, for a certain amount of time, and then to go back to their original role. So, you know, there is an ongoing management of those identities, and there is a problem that we see where somebody just keeps getting permissions added on, and then in the end, they're kind of almost like domain admin, you know, that they've got that much permission to things. So we want to try and stop that. And one of the ways we do that is through attestation and remediation. So we can send out reports. We kind of call them periodic access review reports, which can be scheduled. They would go out to line managers, etc., and say, these are the people that report to you. This is what they've got access to. Is this correct? And that line manager can go down and they can attest to that, you know, by ticking boxes in our portal. And then they could say, oh, actually, this user's moved and they've moved to this department. And that would maybe trigger off a mover process where we'll take rights off and add rights on. Or they may say, oh, actually, this person's left. And it's a good way of catching those users that have left, because IT sometimes are the last to know that somebody's left the organization. So when you mark them as left, again, it will then kick off a deprovisioning process and start to take their rights and access off them across the board, not just disable AD, Active Directory, but it will actually disable all their different clinical systems. And then just to finish on, two elements to this as well. We have a full self-service portal where users can go in and manage their own details, their own Active Directory details. They can request access to applications that they may not normally have as part of their role. Line managers can create accounts for users ahead of them joining through the self-service portal. They can request access for that in, you know, ahead of that user joining the organization. And then the last piece is the risk dashboard and analytics. So we have a dashboard with lots of kind of pretty bar graphs and pie charts to which if you go to the next slide, we'll talk about that now. Thank you. So this is a screenshot of the dashboard here. There's a lot more information and widgets you can actually add in here as well. But the dashboard pulls in both kind of identity and access data to understand user behaviors across your kind of user population. So it connects the identity data, so what has the user been granted, and also the access data, so what is being done with that access, how are they accessing that kind of data as well. And that's key to a successful identity governance solution. The dashboard is actionable, so a user can look at his or her customized view of the dashboard, and they can look at and identify specific areas of risk or alerts that are popped into the dashboard. And within 1 to 2 clicks, they're able to remedy that. You know, either take something off somebody, or you know, move something. Or action something. So it's you know, it's very intuitive, and the information's just there at the click of a button, really. Next slide, please. Thanks, Andy. So yeah, so as part of this identity governance solution, obviously with single sign-on, in the past we partnered with clinical application vendors and things like that. But now with identity governance solution, not only is it the application vendors, but it starts to open up other areas of the business we need to, and other vendors we need to work with. So things like HR and ticketing systems. A ticketing system is a support system. So we need to integrate with those types of systems, credentialing systems, business and finance systems, etc., remote access systems. So there's more and more applications that we have to integrate with an identity governance solution, because it touches on so many areas of the business. But this is also key to, again, Imprivata's kind of strategy moving forwards, especially around the clinical applications, where we have very specific API level integrations with the likes of Epic or Cerner, etc., where we go very deep level into the different types of roles and the different types of accounts that we can create and manage within those applications. Okay, next slide, please. Okay, and one of those partnerships obviously is Microsoft. So I'm sure some of you are aware that Microsoft also has an identity management solution. And the Microsoft solution is, it's very good at kind of doing the Microsoft side, the Azure, the cloud systems, etc. But we partner with Microsoft because we specialize in those kind of legacy and on-premise applications that, the Microsoft solution may not be able to do. So we can work side by side with Microsoft. So we will take care of all those, we'll do the day-to-day management, the automated provisioning into the legacy systems, the attestation and remediation, etc. And then we have our key integration with our single sign-on as well. So that's where we can obviously populate those credentials, but we can also pull out our audit logs and things like that in order to do different aspects like role discovery, role mining, or our governance and risk and compliance dashboard reporting. So we have a good relationship with Microsoft, and actually the identity governance solution is available on the Microsoft marketplace as well. It's listed there as a solution. So yeah, we have a tight relationship with Microsoft around this. Okay, next slide. I think that passes me over to me now to do a quick demonstration. Keep this fairly high level. If you could make me presenter, I think now, please.
Yeah, you're ready for that now.
Yeah, ready now. Yeah. Thanks.
Okay, Matt, over to you.
Okay, brilliant. So hopefully this works. Can everybody see my screen?
Yes, we can.
Yeah.
Okay, great. Okay, just bear with me a second. That's better. The resolution was a little bit strange. Okay, so basically this machine I've got here is just an Imprivata kiosk, kind of part of our single sign-on solution. It's a fast user switching kiosk, and as you can see here, this is our kind of login, Windows login UI, and this is all customizable. I don't know if you're familiar, but you can change the background image, the color, the text, the logo, etc. But I'm just going to use this machine basically to show you kind of a standard workflow of the identity governance solution. Now, normally, from the HR system like ESR, etc., we can automatically take those feeds and start to trigger the identity governance solution to go and do things. But in this case, I'm going to kind of log in to the desktop here with my HR user, and I'm going to kind of manually create a user in our mock HR system, just so that I've got some data to trigger that process. Okay, so let's make a name up. So I'm going to go through and put in, this is just what the HR person would do, or the kind of data we're getting out of a HR system or a spreadsheet, etc. But you can go and fill, further information out as well in here. But for the HR person, they're just doing their normal job. They're just creating a user in the HR system, and that's it. They don't really see anything different. But what's happening in the background at the moment is the HR system now the identity governance solution, has seen that there's been a change and taken that information in, and it's going away and creating this user an Active Directory account, an email account, and any kind of application accounts that they need to do their job. So if I now lock this workstation and I attempt to log in, okay, so the fact I've logged into the desktop means I've got an Active Directory account with the correct permissions and roles. It's automatically asking me to finish my enrollment in single sign-on, so I could enroll my badge, you know, for tap on, tap off, and my security questions for self-service password reset. But I can, I'll cancel that and do that later. And it's also obviously as part of my role, I need email, so it set me up with my email account here. Now, just before I launch email, what you'll also see here is that it's going to automatically sign me into email. So not only has it granted me access, it's also fed my username and password credentials into single sign-on. So even though I don't need, you know, I've got access, I don't know my username and password, but, you know, really I don't need to, because I should have single sign-on wherever I go. Okay, so that's email, that's AD, that's single sign-on, and also it's automatically created me an account in our identity governance solution itself in the self-service portal. So if I launch the self-service portal, again, like email, it's not only going to have granted me access to the self-service portal, but it's also going to single sign me in. Apologies for the delay. This is running on my machine, so sometimes takes a little bit longer. Yeah, so it's automatically going to sign me in. And you can see here I get access to kind of the dashboard for self-service, so I can see different things like the job code and the facility, department, different user details. I can click on applications and I can see what applications I've got access to as part of my role. And I can also, if I wished, I could add an application at this point. So I may want to add access for an application I wouldn't normally have as part of my role, but I may want access to one of these apps, and I would add that application in. And you can also set date parameters around that as well. So if it's a temporary access you require, you can have that on that page as well. And there's different elements that you may want a user to edit as well. So you may want them to keep their a phone number up to date, or they'd be able to make name changes from here as well. And we can feed that information not only back into Active Directory, but we can populate that around the different applications as well that may consume that information. Okay, so, but one thing I haven't been granted access to automatically is the Cosmos, which is basically our mock EMR system. So it's not automatically created me an account for that system because I need training in this scenario. So what I'm going to do now, I'm going to switch from the user and I'm going to switch over to Miranda, who is my training manager. See, she logs in here. And Miranda is just going to open up her email, obviously get single sign-on as normal. But she's got a new email now here saying, do you want to basically approve the creation of an account for the Cosmos application for this user? So, okay, this user's now attended their training, they've completed that, that's fine. So I click on create an account. And what that's going to do, it's going to automatically fire up the identity governance solution, automatically log Miranda in. And it's going to, instead of me having to find that request, it's going to automatically take me straight to that approval request. I can go down and check some different attributes and entitlements that this user may have. I can add additional information. This is all a customizable form. Set a termination date, but really at the end, it's three options. I either can cancel and put this back in my queue, and maybe I can have a, if I don't action it within a certain amount of time, it escalates it to my manager. I could reject this and I'm forced to put comments in on why I'm rejecting this, or I'm going to hit approve, which I'm going to. Now, what you're about to see next isn't what Miranda would see. This would actually happen on a machine in the data center, but I just show this so that you can actually see what happens. But Miranda would hit approve and that would be job done for her. But if I click approve, what you're going to see on that machine in the data center, it would actually fire up a copy of the application, sign in, And using our RPA tool, we start to automatically navigate through the different screens and fill out, I'm not doing anything here, I'm not touching anything, fill out all the different entitlements and attributes that that user needs within that application. As you can see here, it's putting them in the right location, etc., etc. OK, and closes the application down. Now that tool is extremely powerful for us, and that's one of the the biggest benefits that especially like Microsoft see with us is we can automate those applications that don't have API interfaces, that don't have standards-based interfaces. We can manage all those legacy systems quite easily using that RPA tool. So now that it's created for the user, if I just quickly log out and log in. Okay, so now if I launch the, oh, sorry, just do that later. If I now launch the clinical system, again, you're going to see not only is it given me access now, but it's also fed those credentials again into single sign-on and automatically taken me into my system. So again, I don't need to know my username and password for that because single sign-on will always take care of that. And really for the end user now, that's it. They can, it's that quick, they can go about their business and do their job. The very last thing I just wanted to briefly touch on then is I'm now going to log in as an IT admin or an IG person. I'm going to go to the identity governance solution. Now they're going to get a very different look and feel to what Miranda had and also what the end user had. They're going to get the GRC dashboard. So as you can see here, this is the GRC dashboard and with all the information on there around unauthorized accounts, etc. Something, obviously we pull through some of the single sign-on audit information so we can see which applications we're signing into, what workstations you've got out there and types of workstations. But something a lot of our customers have been keen on in here is the license counts. Because we're managing what identities are being created in those applications, obviously we know what licenses have been allocated. And we hear from a lot of our customers, especially things like Office 365, it's sometimes a bit of a struggle to, if somebody leaves, you don't always take the license off them. Somebody starts, you give them a new license, and then the next minute you need to buy more licenses because you've run out. And that goes the same for a number of systems. So, but with this, because we are deprovisioning the user and making sure the licenses are like, if you in effect taken off them if they're reusable, you're always on top of your license count, and that's something that's been very important for a lot of our customers looking at this solution. But as I said, there's a raft of information. It would take a lot longer for me to go through all this. But the last thing I just wanted to show as well is the deprovisioning process. Again, we would normally take this as an automatic feed from ESR, and we would trigger this. But I'm going to actually deactivate or archive this user manually. So I can do it from here, or I can click into their profile and do it from there as well. It's going to say what it's going to archive. So this is all the different systems it's set me up for. Click OK. Again, we can be selective here. So we could say, well, actually, I just want to take a certain application off this user. But in this case, I'm going to take all of them off the user. Click OK. And then what that's going to do, it's going to, again, in the data center, it's going to automatically fire a copy of that application up. So the information governance, the person that's doing this wouldn't see this. This would just be in the background. Launch the application, navigate through, and this time we're going to disable a user instead of obviously creating a user, and we close down the application. And at this point as well, you can go through the different screens here and choose if you want to edit any information before you archive this user for all the different applications. But basically, you can see now that that user has been archived. So if I go, obviously, if I go to try and log in as that user, probably going to catch me out one day, this, but hopefully not. This should have, yeah, it will now deny me access to log in because it's disabled my AD account, but it's also disabled all my accounts across the board. And that brings me to the end of the demonstration. I'll pass back now to, I think, Andy.
Yeah, Thank you very much, Matt. I'll get the slides back.
Thanks, Andy.
Okay, Andy, over to you again.
Superb, thank you. So we're coming close to the end of the presentation now, and I do want to make sure we leave some time for Q&A at the end. So just wanted to kind of close this out by talking about the experiences we've had with our NHS first NHS pilot, which actually went live last year, and that was up at NHS Bolton. And we've talked, I mean, Matthew's talked about it, I've talked about it, that, you know, their key challenge was that managing of the joiner, mover, leaver process, how they onboard staff, how they manage staff as they move throughout the organisation, and how they deal with people leaving the organisation. And they did some evaluation of solutions on the market, solutions available, and they came to us because at the time our identity governance product was only available in the US, but they knew we had it. So they approached us and said, look, you know, we'd be happy to work with you in a partnership to pilot this, to test it. And we thought that was a great opportunity to bring it to the NHS to see how it worked, when it interacted with the key applications, the key data sources that you in the NHS use. And we actually began the implementation in February last year, right before COVID hit, which is never the best time for things like that to happen. But we managed, we worked very closely in partnership with them. Their IT team were phenomenal, and we actually managed to deploy, get this all set up, ready to go and live within 4 months across that kind of March through to June period, ready to go. And I mean, the benefits they were trying to get were reliability, efficiency and accuracy. I mean, that was the key driver before they went into this, was what they wanted to achieve. And I'm actually going to skip on to the next slide to talk about what happened that first week when it went live. So they were focused very much on getting it live ready for, as a teaching hospital, for a new student intake, which happened, I think, at the beginning of August last year. And it was about 100 staff, something like that, that they were looking to onboard. And the identity governance was hooked into the ESR to provide the inbound source of truth, to take the details of the new staff joining and populate all of the records. And actually that digital onboarding took seconds to do, about 90 seconds to onboard all of those 100 staff. And that process would normally have taken them over a week, maybe as much as 2 weeks to do. And that was provisioning Active Directory, email systems, their EPR, which is Allscripts Summarize, as well as Patient Track and their PACS system. So all of that was provisioned for all 90 users within a matter of seconds. The system was also running in the background. So actually what they also saw as well, which they hadn't planned to pilot, but just happened, was that bank staff were being automatically onboarded. So as soon as a bank staff came up in the ESR and was downloaded on an overnight feed in the CSV file, Identity Governance would pick it up and provision their account. So, that was a huge benefit to them, just, within a matter of days of switching it on. And they're also looking, because part of the pilot was to look at what additional benefits it could potentially bring. And what they were seeing straight away is that it gave them a massive insight. I mean, Matthew talked through the GRC dashboards and the widgets and what that can show you. And what it was giving them was a huge insight into the accumulated permissions that users had. And also it showed them immediately that it could reduce some of those human factors in account creation. So typos in a username, or incorrect titles, or all those little things that we know happen. And it might seem really simple, but can sometimes take days or weeks to actually resolve when they're picked up as being wrong. And when they were also looking at the system, they felt, although this still is being looked at for, to come to conclusive proof, is an improved level of compliance. So what that really means when we dig into that is reducing the number of generic accounts in use, and all of those kind of workarounds that are put in place to facilitate clinicians doing their job, which is caring for patients, but maybe you could look at as not being fully in compliance with the requirements that they have to be. And also, automating something, digitizing a process provides consistency that humans don't necessarily provide. So repeatability and reusability of that process, so it's the same every single time. And that's, they're still using the system now. We're seeing more and more benefits come along, and it's really exciting to see how it's being used in practice within Bolton. And Matthew, I know you've been pretty close to Bolton of one of your accounts. I don't know if there's anything you want to throw in around the project.
Yeah, no, I think it went really smoothly. The technical team there were, kind of great to work with, and we, they were very accommodating of our remote needs to build this and deliver this. But yeah, I think just really echoing all the things you said. It was kind of when it was put in, it was like, oh, okay, yeah, this is great. But when it actually delivered, those 100 or so users in less than 90 seconds, which would have normally taken them kind of a couple of weeks to onboard, they were blown away, which was great for us. It means it does what it says on the tin, and yeah, I think they're very happy with it.
Yeah. And I mean, I guess just to kind of finish on that clinical perspective, Dan, I mean, from your perspective, having the benefits of what we've seen at Bolton as a clinician must be, immeasurable in a way.
Yes, very much so. And I can't emphasize enough when you said, I think you said mentioned something about the spelling of a name, or there was an underscore in terms of maybe usernames of who it is that you're providing credentials for. All of those are kind of real, genuine challenges that non-technical individuals, which principally would be kind of, some of them will be middle managers, nurse managers who are overseeing credentials, or certainly the approval of them. It has to accommodate when we've got all the other pressing demands that are all going on, and there's an awful lot of back and forth going on. So it's ensuring quality, never mind the further implications for managing risk in our digital systems, is just a big burden. So to be able to kind of see that being realized at Bolton, and for it to be streamlined down to an approval process and a quick review by a middle manager or a supervisor, has made a big difference to them.
Yeah. So that brings us to the end of the presentation. I just put up a slide. There's plenty more information available around the pilot itself, around the product, around our digital identity framework, available on our websites. If you'd like more information, I mean, Andy and the team at IT Health, more than happy to set things up and have a conversation about it. And obviously we've got our Imprivata team as well who support them in that process. So Neil, who covers the South Wales and Ireland, and then Vanessa, who covers the North and Scotland. So just say thank you very much for attending, and if there are any questions, please do pop them in the chat. We've got a couple of minutes.
Thank you, Andy. It's Andy Sherritt here again from IT Health. I'm just looking at the questions in the chat. It's quite small for me to read, but I'll try and read it verbatim. We previously tried integrating ESR and AD. We ended up having to manually delete thousands of duplicate accounts. How do you prevent this happening?
Yeah, I can take that one. So, in the Imprivata Identity Governance solution, we actually have a duplicate user logic. We also have a rehire logic as well. So, using that logic, we're able to, kind of determine if those users exist, or if we're trying to, create a user that exists and we just need to reactivate their account as well. So we do have that logic built in. With ESR, some of you may be aware that ESR doesn't have a direct API interface as such yet. maybe one day. But so what ESR, what we do is that they can actually dump the user data into a CSV file overnight, and we take that CSV file and we parse it and we put it into a format that we need it to digest, and then we take that data in and then we create the users or deprovision the users, etc. on there. But yeah, definitely duplicate user and rehire logic is a part of identity governance. It's built in.
Perfect. Thank you, Matt. Yeah, there's no other questions in the chat at the moment. So that kind of just leaves me to wrap it up, really. So thank you everyone for joining once again. We will be issuing you with a survey immediately after this webinar. I'd be very grateful if you fill that in for us so we can get some feedback for the kind of ongoing program of webinars that we do run. And also just to reassure you that we will be sending out a recording of this webinar along with some handouts. So yeah, you can get that content by email shortly after this. But for now, thank you again everyone for joining, and to our presenters for today, and have a good rest of your day everyone. Thank you.
Thank you.
Thank you.
Thank you.